Have you ever jammed your finger playing basketball, or maybe dropped something heavy on your hand? Finger injuries are more common than you think, and sometimes they're more than just a bruise. They can actually be fractures or broken bones. So, what happens if you break a finger? Let's talk about finger fracture fixation, a fancy term for how doctors fix broken finger bones so they heal the right way. Basically, finger fracture fixation is a medical procedure where the goal is simple. Put your broken bone back where it belongs, keep it there, and make sure it heals strong. That way, you can get back to normal function and avoid long-term problems like stiffness or a weak grip. Now, there isn't just one way to do this. Doctors choose the best method for your injury. First, there's splinting or casting. That's for easy, non-displaced fractures. Think of a splint as a little suit of armor for your finger, keeping it still while it heals. Next up is K-wire fixation. These are thin metal wires that doctors slide through the bone to hold the pieces together. It sounds intense, but it's super effective and often used for trickier breaks. Then there are screws and plates. These tiny devices are surgically attached to stabilize more complicated fractures. And for really severe cases, like open fractures, doctors might use something called external fixation, a frame outside your finger connected by pins. Here's how the procedure usually goes. First, you'll get local or general anesthesia, so you won't feel a thing. The surgeon carefully lines up the broken bone fragments, applies the chosen fixation method, closes up the wound, and adds a dressing or splint. After that, you'll have follow-up x-rays to make sure everything's healing as it should. Healing usually takes about 4 to 6 weeks, depending on how bad the fracture was. Physical therapy is often needed to restore movement and strength, but most people bounce back with normal or almost normal function. Now, there are some risks: infections, stiffness, or the bone healing in the wrong spot. Sometimes the hardware needs to be removed later. But with proper care, these complications are rare. Bottom line, finger fracture fixation is safe, effective, and designed to get you back to your daily life, pain-free. If you ever suspect a finger fracture, don't wait. See a doctor, get it checked, and follow through with treatment and rehab. Your fingers will thank you.